Good morning, everybody. My name is Geneva, and I am the project coordinator for the ACORNS project here at CRIB that's funded by CDC's Good Health and Wellness in Indian Country grant or cooperative agreement. And today we're going to talk about the different components of the request for proposal and the information that's included in it, as well as the required application materials that you will need to submit to be funded by this project. So I'm joined here with my colleague.
Hi, I'm Fareen Farouk. I'm the program evaluator for the ACORNS grant.
And also Ephraim and Julie, if you want to introduce yourselves again as part of our team.
Sorry, I was on mute. Hi, my name is Ephraim Lopez. I was on the last round, and I'll be on the team for this round of ACORNS. And I'm looking forward to working with everyone.
So good morning all, my name is Julie Villa. I'm the health education specialist here at CRIB for the past 20 years. And I will be here to assist you throughout the ACORNS process. Welcome.
Thanks. Okay, so we're gonna, like Julie said, spend the first part of this going over the materials, and then for the last part we'll take questions. So we're just gonna jump right in. Okay. So today we're doing the application webinar. We're gonna go over the application timeline, eligibility requirements, project requirements, the application, work plan, evaluation form, some supporting materials that will help you with your application, how and where to receive and request technical assistance, and then we'll go into questions. So just some important timeline and important dates. So the RFP was released on November 4th. Applications, I'm sorry, there's a typo there, are due on December 6th, minus that 16. On December 6th by midnight, they'll be submitted to me, Geneva Sorensen at jsorensen@crib.org. We'll be releasing the notices of award on January 10th, which is the official project start date. We'll be having, if you're funded, we'll be having a mandatory ACORNS introduction webinar on the 16th. Your first grant deliverables will be due on the 24th of January 2020. And there will be a required in-person kickoff training that will be held here at CRIB offices in Roseville, February 5th and 6th, 2020. So although these are required only if you get funded, we just want you to know those dates up front so that as you're applying and you're planning for your year, they're kind of quick up in the beginning of the grant, so just to mark your calendars for those as an applicant. So let's jump into eligibility. This year's, or this round, or 5-year Good Health and Wellness in Indian Country, or GWIC funding, has different eligibility requirements. We have 3 funding tiers, and there's different eligibility requirements for each of those tiers. So tier 1, which is the larger award amount, is only eligible to CRIB member tribal health programs that represent 2 or more federally recognized tribes. So if you are a CRIB member, full member, or associate member tribal health program that represents more than two or more tribes, then you are eligible for that top tier funding. So some examples of this is Sonoma County Indian Health, Riverside San Bernardino, Toyabe Indian Health Project. So tier 1 is eligible only to tribal health programs. Tier 2 is also only eligible to tribal health programs, and that's for tribal programs that represent at least 1 federally recognized tribe. So for the Mathesons, that would be you, since you represent 1 tribe, that's a CRIB member tribe. And then finally, tier 3 is only eligible to CRIB member tribes. So if your tribal health program applies for the grant, you are also eligible to apply for a smaller tier 3 grant as a tribe that is part of that health program. But this would be a tribe that's applying for it. Unfortunately, this year, no tribal organizations that service CRIB member tribes are eligible to apply, as was previously allowable. It just has to come from the tribe as the applicant. And eligibility requirements can be found on page 5 of the RFP package. And you should have all received the RFP package. And if you haven't, please reach out to project staff. So on page 6 of the RFP, we have the project requirements. So the way to use this table is to use the tier columns on the top. And if you go all the way down, and if the cell sphere spans across all of them, that means that it's required for all 3 tiers. So tier 1 has all of these project requirements, tier 2 has all of these, oops, and tier 3 has these. Project requirements vary based off of the level of funding that's awarded. So those that are tier 2 and 3 are required less than those that are tier 1 since their awards are smaller. One thing to note on here is that everything that's listed in the project requirements on this table must be included on your work plan somehow. So these are activities that we're asking that you complete as part of your work plan. We'll talk a little bit more about that, but the sample work plans included in the RFP package actually already include these in there. So you can utilize those as a direct resource for filling out your work plan if you're interested in that. Okay, going into the ACORNS application. This is on page 12 of the RFP package. So I'm going to go ahead and just jump into the RFP package to look at it. So this is what it should look like. If you open up the tabs on your PDF viewer, you should be able to click through some of the different sections of this. So in the RFP package, you have your important dates, some background information on the funding and why we're supporting these activities, as well as some of the intended outcomes and approaches that you want to use. As an overview, ACORNS is a 5-year project funded by CDC. Our year 1 focus, which is this year's application, is really focused on assessing needs and assets, building staff and organizational capacity, and engaging your stakeholders, developing partnerships, and planning for strategy implementation. So actually this year, because there's going to be a new pool of applicants, we wanted to use year 1 as an opportunity to really engage your community, to really assess the needs of your community based off what the project is trying to accomplish. So that's why we've included a more robust amount of project requirements this year for you to sort of get your team and your organization ready to do more strategy implementation in years 2 through 5. So years 2 through 5 is really focusing on implementing and evaluating strategies which address the needs identified in your year 1, and then as well continuing to build your staff and organizational capacity, developing culturally adapted health messages, and developing partnerships. So that's just kind of like in a capsule the year 1 through 5 focuses. On table 1 in the RFP, we're on page 4 of 11. I would just make yourself familiar with this table. There's 4 main project strategies, which are the 4 main project areas. These are things that are going to come up again and again as we go through this project. The first one is to prevent obesity. The second one is to prevent and control commercial tobacco use. The third is to support type 2 diabetes prevention. And the 4th is to support heart disease and stroke prevention. So these 4 main strategy areas is what every applicant project should be focused on. And then in this right-hand column are the intermediate project outcomes. Again, these are the intended outcomes of this funding. So as an applicant and as a team collectively working on this, we're going to be hoping that by the end of year 5 that we'll have reached some of these outcomes. So as you're developing your plans and meeting with your leaders and stakeholders, just know that these are the intended outcomes, and whatever you're proposing falls in line with some of these outcomes. So we talked about eligibility. The project period is January 6th through the 14th. We have different tiers of funding, which we talked about. We talked about project requirements. These are project deliverables, so there's going to be 3 payments. The first one is 50% up front, second one is 25, and the third one is 25. So these are all the required deliverables that will be needed in order to receive those payments. And this is a deliverable-based funding opportunity, so there's no financial reporting, but you are responsible for submitting the appropriate deliverables in order to receive payment. Starting on page 8, it has the application review requirements. So you should be able to see what you're going to be graded on and how many points each of those are worth. There's also some budget guidelines. So, and then on this last page, this is a really helpful, there's a lot of helpful attachments. We'll go over them more in detail, but here on page 11 of the RFP, these are links to different sections in the RFP package that provide some helpful information. So in order to apply for this funding, you will need to submit 3 different things. The first one is the application. I'm going to scroll back up here where it's listed. You have your application, your work plan, and your evaluation form. So we'll be going over how to fill out each of these. And then as a reminder, we'll take questions, specific questions at the end, and we'll try to leave you plenty of time. Hopefully it won't take the full hour and a half. Okay, so this is the ACORNS application. I just want to quickly note that all of these are available in Word. So if the PDF version is not working for you, you can request them and we can send you a Word version of these. But you'll fill this out. This first page is pretty basic: contact information, your official contact. This is the person that is going to be signing your subcontract if awarded. This is also the person that takes liability and ownership over meeting grant deliverables in the legal sense, and should be the authorized signature of your organization. The project lead is the person that's going to be responsible for carrying out the project activities. So those should be different. You are able to, like, for example, if you're a tribal health program that services more than 2 tribes, you are eligible to apply for Tier 1 or Tier 2, but you would have to submit separate applications for those. So you would indicate which one of these you're applying for. Please select one per application and your total funding request. On problem statement of the application, this is really your needs statement. So this is using data to describe the need for chronic disease prevention in your community, specifically focusing in those heart disease, obesity, commercial tobacco use, and stroke and diabetes. So please provide a rationale for why you're selecting which focus area, and use data to support that rationale. We are at CRIB is housed the California Tribal Epidemiology Center, which does have tribal specific health data. So if you, as a CRIB member tribe, you likely have a data sharing agreement with us, and you are more than welcome to submit a TA request to CTEC if you would like some support identifying or locating some data to put in your problem statement. Additionally, we do have Carol Madam, who is our grant writer, and as a CRIB member tribe, there's some technical assistance available for that. So then after that, after you use data to support the need for chronic disease prevention in your community, the second one is how will you address this focus through PSC, policy systems and environmental changes, or clinical community linkage strategies. So policy systems and environmental changes and clinical community linkage strategies are mouthfuls, and they are going to be used, and you'll hear them all the time. They are sort of the focus approach based on what CDC has asked for how to address some of these topic areas. So you'll hear us say PSE or CCL, and that's what they're standing for, or they stand for. So using some of those strategies, describe how you will use that to complete the project requirements and implement the project that you're applying for or proposing. So work plan template, we'll go over that in just a second, but you are required to submit a work plan proposal as part of your application. The next section is organizational capacity. This is a really important section because especially for some of these larger grants and based off of doing work in public health, we know that using a team and having the capacity to do the things that you set out to do is very important. So we want you in this section to outline who will have day-to-day responsibility for key tasks like leadership of the project, monitoring it, conducting evaluation, preparing the reports, doing financial tracking and management. So we really want you to explicitly identify who is going to be on this team, what is their experience, and how are we going to make sure that everything you're proposing will be completed within the project time period. So the second piece of that is, again, this type of work requires a team approach and support from your organizational leadership. So this section is to describe any additional staff, including leadership, who will be supporting this project. Describe their roles, level of involvement, and how they will be engaged throughout the project. So just from personal experience, even previous awards, not having leadership support can be a really big challenge to actually accomplishing your goals. And so we want to see that early on your leadership has been engaged, they understand what you're applying for, and that they are supporting the work that you're going to be doing. So this is the opportunity to describe how you're going to be engaging and getting support from your organization or community in order to do the things that you're proposing. The next one is about your organization's experience in grant management and implementing PSC and CCL strategies. This one is an opportunity to talk about the challenges or barriers you anticipate to implementing this project, and how will you overcome those anticipated challenges. So it's realistic to have challenges and barriers when doing public health work and community health and wellness projects. And in fact, if you think there are no barriers, then that's surprising, because there's always problems. So it's not about not pretending that there won't be any problems or potential barriers to being successful in your grant proposal, but more so letting us know what you think they might be and then how you might overcome them. This is really helpful to do as you're planning, because if you come up with a barrier that you really don't have a solution to, or you're depending too much on maybe somebody external or an external partner, and they don't follow through, and then that makes you not be able to accomplish your grant goals, maybe that's something to consider and revamp when you're in your application or your proposal, or switching things up so that whatever you're proposing, you know that you have more control over making sure it gets completed. And then the final piece is on organizational capacity is incorporating culturally adapted approaches and values. So CDC certainly lays out some different strategies that they want to see implemented, but also a large part of this funding is how do we address these chronic diseases in tribal communities using culturally adapted approaches and values. So any sort of twist on that, or creativity in that, or proposal in that, or inclusion of that in your project is really important, so that we can make sure that these projects are really supporting the needs of our community in a culturally tailored way, and that they're more impactful that way and more well received. So this is an opportunity for you to describe how your organization has the capacity to do that in order to meet the project outcomes. Okay, and we're going to check in on evaluation in a quick second. On budget, so you are able to use your own budget template. If your organization already has one that you prefer to use, that's fine. We just ask that you make sure that it includes these different categories and columns. Please note that it says a detailed narrative on all requested program costs. So for example, if you're typing in salary, instead of just putting an amount requested, you would need to put the staff member, how much time, what is their rate of pay, you know, and doing the math so that we can see where that money is allocated. Same with supplies. Again, you might not know the exact number or cost of supplies, but you can do a quick Google search if you're going to get, you know, blood pressure monitoring cuffs, and you're wanting to get 20 of them, you can do a quick estimate of how much that will probably cost. Or if you're planning on holding X amount of meetings, you know, how much supplies would you need for each of those meetings, or what would those be? So please give us details. One thing to note with travel, Tier 1 applicants are required to pay for their own travel to the ACORNS resource meeting in February. For Tiers 2 and 3, CRIB will provide some financial support to get your staff there, because your award amounts are not that big. And then same with consultant and contractual. If you're going to be hiring on somebody to do different work, please indicate what that work is, what their rate is, and what they're going to be accomplishing for you. And then the final piece, and very important, we've had applications submitted without a signature, but We need to make sure that whoever is in charge and actually legally responsible to make sure that your work gets accomplished has seen your work plan, has seen your proposal, and approves it, and is signing off on it. That is something that they're agreeing to do. So that was a really quick work through on the application. We're going to jump into the work plan. Since I know there's probably a lot of questions, and we want to make sure that we can answer all this. Okay, so jumping into the work plan. So this is the work plan template. The template is blank. The way to fill it out, make sure you put which tier you're applying for here, and then the name of your tribal health program. This front page is just a glossary of terms. So you don't actually, other than these two sections, there's nothing you need to fill out on this first page, but I do recommend that you read these because they will help you as you fill out these sections. So the project strategy, this whole top section is basically based off of one of the supporting documents. And I'm gonna actually just jump down to it really quickly because it's helpful to explain it as we go through this. So in your RFP package, there is the ACORNS strategies, activities, and outcomes. It looks like this. This is going to be kind of like your bread and butter a little bit for trying to propose activities and fill out some of your work plan. So like I mentioned before, there's 4 main strategies. You'll notice there's a section for each one of those. So there's the obesity, commercial tobacco, diabetes prevention, and heart disease and stroke prevention. And then in these columns, there's activities, short-term outcomes, and intermediate outcomes. These activities, I know oftentimes activities are used for like specific tasks below an objective, but these are actually really high-level activities. So to improve tribal food and beverage programs and systems, there's a lot of different ways that you can go about doing that, right? But these are the approved activities that are allowable. And each of these activities have a direct outcome associated with them. So the short-term outcome is a 1 to 3 year outcome, and then the intermediate outcome is a 3 to 5 year outcome. So when you are filling out your work plan, the strategy, the activity, the short-term outcome, and the intermediate outcome, these are all on the work plan template form. And they're all in this top section. So you're going to use this strategies, activities, and outcomes to really help you fill out your work plan template. So if I'm selecting that I want to do diabetes prevention, I would select that. My project activity, I would go here and I would go into my obesity prevention and select which activity I want to work on. So there's things on breastfeeding, there's things on physical activity, there's things on food and beverage systems. And then, so say I selected, activity A1.1. And then if I go back to my work plan template, if I copy that activity and I paste it right here. And then that short-term outcome is going to be exactly this one, S1.1. I'm going to copy that short-term outcome and I'm going to paste it right here in my short-term outcome section. And then same, you move across that same row and you would paste the intermediate outcome associated with that activity. So they should all be linked together with the hope and intention that we know that the things that we can link, that the activities that we're accomplishing are directly working towards the outcomes that we're wanting to see from this funding. So hopefully that feels clear. And then on your objectives, this is like a typical work plan. So because that activity of improving food and beverage systems is pretty high level, then you would write here, what are you going to be doing specifically in your objective to meet that or to meet that activity or to accomplish that activity. And then you'll have your smaller activities here, your timeline, and the staff responsible. So for each objective, there's multiple pages for this. For each objective, it should fall under only one project strategy. So if you select more than one project strategy, then you would just need to change the associated outcomes with it, and the activity is associated with it. So one thing to note, and there's multiple of these. These again are available in Word, and I have extra pages available if you end up needing more than the 3 pages that are provided here. I want to just go quickly to the sample work plans because we actually did you a favor to try to make it easy for you to fill out your work plans. So for each tier, there is a sample work plan, okay? So we're gonna just look at tier 1. And as you might remember, there's project requirements for each tier. So what I did was I put in an example of how you could include those project requirements in a work plan, in this work plan template. So if you want to, and if it meets what your identified focus area is, so this one I selected project strategy for, you can change it. But basically I included all the activities that are required in this sample template. So identify and regularly engage a project team, that's a project requirement. Complete the training needs survey, that's one of your project requirements. So basically you could use these sample work plans and modify them just slightly by including your own timeline, including your own staff members. And then if you didn't want to focus on stroke disease prevention, you could change that project strategy to meet whatever you wanted. But basically building staff and organizational capacity in order to implement those strategies is an allowable objective. So these sample work plans actually include all of the project requirements. The only reason why you would need to maybe modify it is for the timeline, the staff, and then also if you added some things in your budget, like you wanted to buy blood pressure cuffs, or if you wanted to send a staff to some training, and it's written in your budget, then it somehow needs to match into your work plan. So as many of you know with grant writing, what's written in your work plan and allocated in your budget need to match, and they need to reflect each other. So there's these sample work plans that are available for tier 2 and for tier 3. So hopefully that makes it a little bit easier for you. Since year 1, we did put in a lot of project requirements because it's kind of a planning-ish year, with really the hope that you'll take the results from some of the required assessments and the prepare tool in order to make a plan for years 2 through 5 and really do a lot of the more implementation phases during years 2 through 5. So hopefully that makes sense. Again, we'll open it up to questions because I know that was a lot. So I'm going to pass this over to my colleague, Breen, and she's going to go over the evaluation form.
I'm just going to go right into the evaluation form on the application. So here it is. So we do ask that you read the form in its entirety and complete all sections of it. There are 3 sections of the form. You'll fill out the tribe or tribal health program that the application is for, the tier that you are applying for, so tier 1, tier 2, or tier 3. And then we ask here for you to identify the project strategy areas you'll be focusing on. So it's either you'll implement evidence-informed and culturally adapted policy system and environmental changes to prevent diabetes or to prevent and control commercial tobacco use, and you can do all of them if you choose to, implement evidence-informed and culturally adapted clinical community linkages to support type 2 diabetes prevention and to support heart disease and stroke prevention. So that does need to be completed. And then below, there's a small outline telling you the sections for this form. You don't need to actually fill anything out here, but it's useful because all the tiers have different requirements. So section 1 and 2 are to be completed by all tiers, and section 3 is only for tier 1. And I'll continuously remind you that as we go through the rest. This is the short-term outcomes page. Here, you will be selecting the short-term outcomes that you would like to focus on based off of the strategies that you chose above. So if you decide to increase the number of places offering health foods and beverages as a result of improvement of the food system under strategy 1, you can click that here. And we ask that you complete this like as best as you can because you're going to use this for a reference later. So it's the same for every strategy, and this is similar to the rest of the application. So it's you should be able to use your work plan to fill this out.
Yeah, the short-term outcomes that you're going to be selecting on this page should be the same strategy or short-term outcomes that are included on your work plan. So if you put it on your work plan, it should be selected here.
Yep. And you'll use this page as a reference to complete this page. So we do ask for you to rate your evaluation experience before you start going into this. So it's completely based off of what you believe your evaluation expertise are. And then we ask for this blank area to be how you describe how you will be evaluating your specific short-term outcomes in your project. So you'll include data sources, data collection methods you're going to be utilizing, how you plan on analyzing the data, and how you're going to use the findings from analyzing the data to enhance your project as you're going through it. So process evaluation. Here, this is for all tiers as well. This is section 2. And this, you don't actually have to fill anything out on this page. This is just small instructions, and it tells you the components for the rest of it. So we do ask later on for you to, actually I'll just go down to it, might as well. Here's an example. This is what we're asking for. It's actually your evaluation plan. So we give you a pretty broad example. It's the same objective as above in your work plan. By September 2020, you'll build staff and organizational capacity to implement selected project strategies. And you can put in an impact and a process question, or you can choose to do 2 process questions. It's completely up to how you decide to plan your evaluation. So the impact question we have here is, did the staff and organizational capacity increase upon implementing this program strategy? And then the indicators that you have chosen to evaluate this impact question. So the number of staff included in the training, and then the data source used for this specific indicator is tracking logs. And for staff knowledge assessment, it's the pre and post survey, and the same for the process evaluation question. So how well was the strategy implemented and received? And staff assessment on implementation process is one of the indicators used to answer this question. And a group meeting with written notes was the data source and tool used for this indicator. And then here, this is what you will be actually completing. So it's very similar. We're just asking you to do this based off of your objectives, the evaluation questions that you will be asking, the indicators that you will be using to evaluate, to answer the evaluation question, and the data sources and tools you'll be using for your indicators. And this is the last page. This is not for tier 2 and 3. This is only for tier 1. So we're asking for tier 1 applicants to collect electronic health record data on their active AIN patients. So this information will be on patients that have been seen within the past 2 years on obesity, commercial tobacco use, type 2 diabetes, heart disease, and stroke. So we do ask for you to actually give us the estimated number of how many AIN patients your tribal health program serves. If you could be if you could not estimate, that would be great, but it's okay if you have to. And then we will ask for you to just provide a yes or no answer as to whether you can answer these questions. We're not asking you for the actual data here. We just want you to say, yes, you can access on electronic health record the number of AIN patients who are considered overweight with a BMI of over 25, and for each project strategy indicator. And we do ask that all of this is completed. So if you cannot access this, just say no, it's completely fine. And we'll help you, because we will ask for data later. So we will help you fill this out with the data later. So just put yes or no for these. And that's the end of the evaluation form.
Cool. We're just cooking right through this. Okay, so the last piece is some supporting materials. So I kind of already went over the strategies, activities, and outcomes. That is this. I would just print this off and keep it handy because you're going to be using it quite a bit. You might have noticed how the short-term, intermediate outcomes, the different strategies, the activities, they're really sort of laced between all of the different application materials, and that's with intention. We're trying to make this easy, and we're really trying to make it all sort of connect together and make sense. So the other supporting materials are the required trainings, allowable costs. So as you notice in part of the project requirements is that your staff has to complete like 10, 8, or 6 staff capacity trainings. So it's based off of this sheet right here, which shows you the training topic, which tier it's required for, and if whether or not it's optional. So by the end of the project year, all of your project team will have completed the required trainings, or will have needed to. That being said, we're going to be offering most of these in person at the ACORNS kickoff meeting, February 5th and 6th. If it is not offered at that meeting in person, we will offer them online or through a webinar. But basically, we will make sure that we provide the trainings for you to be able to meet that project requirement. Of course, if you and your team decide or identify some other trainings that are associated with these, or in addition to these that you want to participate in, that's absolutely allowable. But basically, we just want to give everybody that's applying in this year one a baseline data for completing some of the project requirements, like the tribal readiness assessment, understanding social determinants of health, which is related to that prepare tool, understanding PSE and clinical community linkages, so that as we're implementing these projects, we all sort of know the reason, the why behind it. So these are all required, and we'll be sending out, when those are going to be available, but most of them will be in person at the kickoff meeting. The allowable costs here, this is just a resource we put together to be helpful for you as you're developing your budget. It's definitely not a totally exhaustive list of what you can spend your money on, but it's just somewhere to get started. I think that especially for year one, tier one applicants, because your awards are larger and the project requirements don't actually cost that much money. This is sort of some ideas of how to utilize your money. Definitely focus on again, we're doing planning and organizational capacity and staff capacity. So going to trainings and meetings, or going to different conferences that are relevant, or getting trained in certain media things, or an evaluation, or getting registrations or subscriptions to some software that might support your data collection or your reporting or your project management, or whatever that might be. So if you have any questions about what you can spend your money on and what are allowable costs, please don't hesitate to reach out to any of us. We're happy to brainstorm with you and figure out what will work. And then the final piece are these sample work plans, which we sort of went over already, so I won't go through them again. And we've got a couple more things before questions. So technical assistance. Our team loves, Our team loves to be helpful. And actually, this funding opportunity is, what we're really trying to encourage is a collaborative relationship between us as the grantor and you all as subawardees. Our job is not only to provide funding, but it's literally also written in our work plan to provide training and technical assistance to you, and we're very interested in helping you be successful. So that means it's kind of an open door policy. If you have any questions along the way, if you need support or you need guidance or you need to brainstorm or whatever, please don't make us don't feel like that's going to make you look like not a strong applicant. If anything, we would love to see you help you develop a strong application and be successful at this project. So we have a technical assistance is available. There's a TA request form that should have been sent out with the RFP package. It's also available at the CRIB ACORNS page, and you would email those TA requests to Julie Villa, and then she'll distribute that out. And then also we've created individual, a little bit more in detail application videos on the RFP overview, the application, the work plan, and the evaluation form. So all of those are available on our CRIB Public Health YouTube channel. You can also see a bunch of our webinars and videos from our last 5 years of ACORNS if you're interested in getting some more training resources there. And then there's also a link to those videos at the funding opportunity for ACORNS Insight at crib.org. And I'm just going to show you what that looks like. So here's our CRIB page. It can be a little bit hard to find sometimes, but if you programs, prevention, education, health and wellness, ACORNS. So that's our page. And if you click funding opportunity here, you can click learn more here. And this has, again, some overview of the funding opportunity, a link to the technical assistance form and to our YouTube channel. And there's also a link to the application or RFP here. And then this is just a view of our CRIB Public Health, but these are some of the videos. The work plan application and RFP overview are up right now. So feel free to go back and revisit those and use them as a resource. Okay, I know we just blazed through that kind of intentionally so that we have plenty of time to answer questions. So I'm going to stop sharing my screen, and it looks like there's been a lot in the chat box. And
Ms. Geneva, before we go on with questions,
yeah.
There is a couple of folks, a Miss Gina, Sabrina, Catherine, Trista, and the folks from Lake County. If you could type your names and agency in the chat box, please. Thank you.
I have something to add too. We had a few people call in that had some trouble with the link. So we tried to get that to as many people as we could. But just a reminder, this is going to be recorded and it'll be available to everybody if people weren't able to make it today, and we can certainly answer any of the questions that we weren't able to today via the TA request that Geneva was talking about a few minutes ago. So if you guys know anybody that is currently asking for links or whatever, feel free to give us a call and we'll send it to them and try to get their questions answered right now. Thank you guys.
Thanks. Okay. So does anybody are we ready for questions? Julie and Ephraim? Okay. Does anyone have specific questions about the application, about the project in general, the timeline, filling stuff out, using the resources? You have an idea that you want to get feedback on? Will it work? Will it not work? So Sabrina from Bishop asked, is this a 5-year grant again or only year by year? So CDC has funded us, funds, what do they say, available according to available funds. But yes, technically it's a 5-year grant. We will be doing a reapplication each year. So you will kind of apply again, but we're hoping that it will sort of be like a continuing application. So because the scope of who is eligible to apply for this funding is a lot smaller than it was the last year of ACORNS, yeah, and so it's $30,000 per year. So annually you'll have the eligibility to apply for $30,000 as a tier 2 or 3 applicant. Any other questions? Okay, tier 1 from Catherine from Skip, I believe. Tier 1 project strategy indicators. Are we responding for all strategies or just the chosen one? How often will data be requested? So you're going to be responding to all of them, mostly because as part of this funding, we're really trying to build capacity, especially of the tribal health programs, to pull reports and to track your high-risk patients with maybe comorbidities or the ones that are really needing support. And so we want to kind of just assess where the tribal health programs are in being able to access that EHR data. So if you could just respond yes or no to all of them, regardless of what strategy you're selecting. And then for tier 1, you, as part of your first deliverable, You will be reporting on some of that baseline data, which is the stuff that's due at the end of January. That first deliverable is due at the end of January. And then likely it will be like on an annual basis.
Any more questions?
Don't be shy. Another thing while people are thinking is if your tribal health program is planning on applying for this grant, I would, for both ways, if you're a tribe applying for this funding, maybe check in with the tribal health program that you're with to see if they're also applying. Definitely we want to see some collaborations between the tribal health program and the tribe if you're both getting funding. Not to say that you necessarily have to write each other into your work plans, but I would say definitely having some conversation, having some dialogue. One of the large strategies for this funding is clinical community linkages. And as its name implies, it's how do we create better relationships and linkages between the clinic and the services and education that they're offering and getting those to the community to make sure that they're receiving and vice versa, that there's better connections. That's why CHRs or CHWs are really outlined in this as a strong resource to being successful in this project, because they already are sort of that link between the community members and the clinic. Okay, so other questions. So when we apply for first year, looking at including all project strategies and tend to address throughout 5 years potentially. So it actually is going to be based off of your the tribal readiness assessment kind of results. So if you choose to stick on one project strategy for the whole 5 years, that's totally fine. And you won't necessarily have to report on all of those project strategy indicators. Just for the application, we just want to know yes or no. And if you end up selecting multiple project strategies throughout the 5 years, that's fine. I think one thing that I've kind of told some other potential applicants is, for us, we're more interested in what's realistic and really actually having successful, sustainable projects. And if you bite off more than you can chew, we'd rather see you do like 1 or 2 things really well than try to, you know, shotgun out a bunch of different projects and maybe kind of do them okay, each of them okay. So I think as an organization, you'll get to decide like what your approach to this funding is based off of some of your identified needs. But there's no requirement that you address all 5 project strategies. So we're just supposed to choose one strategy for the project, but you want us to gather information on all. So again, this is Marjorie from, these are kind of tier 1 related questions. So for the evaluation form, you're going to select yes or no on all of those, regardless of what strategy you selected. How many strategies you select, again, that's up to you. There's no requirement. You have to select at least one. As far as if you're going to have to report baseline data on all of those project strategy indicators, no, you will only submit baseline data on the ones that you selected as part of your first grant deliverable. Does that answer the question?
If you're calling in, I know you don't have a chat box, so feel free to unmute yourselves and hop in with questions here. That's okay at this point too, I think.
Yeah.
Yeah, thanks, you guys. This is John, excuse me, from Matheson. We were involved in the last ACORNS. One of the things for us is that we're looking to continue or to do is our yoga classes and healthy eating. Would the yoga classes be a component of this ACORNS?
I think that that would probably be something to, maybe let's set up a conversation about that to discuss how we could weave it in. I think
Okay.
it falls under sort of obesity prevention, I think, and maybe clinical community linkages from your wellness center to your clinic.
Okay.
I will say though that this year's funding is a little bit different. In last year's funding, we were able to fund more sort of like health education classes and workshops more. Whereas this year they're really wanting to see more of those systems changes or environmental changes. And so they're like wanting a little higher level of use of project funds. So yeah, go ahead.
We're looking as tying it into maybe on the diabetic side and also on the yoga that we've been able to on fall prevention and for pain management. It's worked, but I don't know that those two actually tie into this round of grant funding.
Yeah, I would say let's set up a phone call to kind of discuss that more in detail, and we can explore how to work that in.
Okay, sounds good. Thanks.
Okay. And that brings up a good point. So if you have like, we can try to, work with you and support you in figuring out how you can make what you're trying to work on work for the funding. So a couple of people have already reached out and had some of those conversations. So we kind of have to play the middleman between what CDC is requesting and requiring, and then also listening to and hearing the needs of your community and organization, and trying to find a sweet spot there that tries to meet both of those needs. So we're interested in doing that. I'm just going to answer another question that I've had a couple of different times while people are thinking of maybe other questions, and that is the tribal readiness assessment that everyone is required to complete. That is something that we have already developed, and you will be just implementing that readiness assessment. So that is not something that you need to create. So we will help you and give you kind of training and some insight on the best ways to implement that. And same with the Prepare tool, we've already drafted it to be AIAN specific, and we'll be providing training on how to implement that and collect some of that data. Okay, one question from Catherine is, at one point in time, we did a green prescription project with CDC to create linkages between medical community, assuming this would fit this grant. Yeah, so anything like with referrals. So, I mean, at the clinic setting, think about if somebody comes in with a fever, but perhaps that's the one time in the year they're gonna come into the clinic, but they are at risk for diabetes, or maybe they're a smoker, or use commercial tobacco, or perhaps have high blood pressure or high cholesterol. Basically, this project is how do we as a clinic and as a community sort of support, one, use that as an opportunity to screen and go through and sort of check off all those boxes with that person while they're in the clinic with us, and then also make sure that they're getting linked to the appropriate education services or prevention services or things that are already going on. I hear many times that there's classes that the clinic is offering, but perhaps nobody is showing up to them, or there's people in the community that wish there was classes going on and it turns out there are, they just didn't know about them. Or you have a public health department and you have your medical staff, but there's no like referral or warm handoff from the doctor or the medical assistant to the diabetes prevention program or the smoking cessation program. And so any way that you can sort of tighten those up, or do a green prescription that is on health education, nutrition changing, or access to food, or access to physical activity, any of those kinds of ideas for how we can support our community members, at the clinic level and then also in the community level is definitely an appropriate use of grant funds. So I think it's really, the intention is like, how do we help people not fall through the cracks? And how do we make sure that the people that really need the support and services from the clinic or from health education resources are getting them? And that can be getting really creative, right? And that's where it's really important as community members and as the people that are sort of on the ground, that you really listen to the needs of your community or understand what those are so that you can help creatively figure out ways or solutions to support those people that really need it. Can we get access to the Prepare and Tribal Readiness tools to preview and utilize that in our application? The Prepare tool is ready to go and it's through, but probably we won't be sending those out until we award people. So I'm gonna just say no. Sorry, they're not quite ready to be printed off and distributed. We have a few more rounds of review to go. Yeah, Marjorie says, I always think one of the most important questions is who are the people we're not reaching? Capacity building is at the heart of this. Absolutely. Yeah, so and I think by CHRs or you know, the people that have the kind of those relationships in the community, like, are they empowered in their role, and do they, you know, what are their roles, you know, and what are the skills that they can bring to the community, or yeah, who's falling through the cracks, who's not showing up here that should be here. And I think sometimes we get the people that, you know, are the relatives of the people at the health center, or, you know, are friends with whoever's putting on the program. And sometimes those are the people that need the resources, but sometimes it's other people that we aren't outreaching to. So how are we making sure that we're really basically being effective in the services we're providing, you know, to our community? And I think also really empowering as a clinic, you know, as a clinic and people that work at the tribal administration, I think a lot of times they're the servers of the community. They're the ones that are really like putting their heart and soul into providing services and really supporting the community and promoting them to be better. And how can we ensure that they feel empowered and that they continue to feel like they're growing or developing or feeling appreciated or understand what they're, you know, like that they feel empowered basically. So it's, you know, working with the healers, you know, supporting the healers of the community while also serving and reaching out to the people that really need the support. So it's kind of a both and. And that's where like this whole clinical community linkage, it's looking at our community kind of as like an organism or something, where we're all these different parts and making sure that those different parts are talking to each other and that they're working together and supporting each other's functions versus pulling away from that and maybe making things harder or putting in a barrier between things being effective. So this funding is really to like, how do we like make this organism sort of function more cohesively in regards to health and wellness and chronic disease prevention. Any other thoughts or questions?
I believe we had an addition to our attendees. So if you have any last minute questions and you're just joining us, feel free to unmute yourselves and go ahead and ask us your questions, even if they may have been already asked. We want to make sure that we get to everyone we can.
Thanks, Efrain.
This is Katya. Can you hear me?
Yeah. Hi, Katya.
Hi. I just joined, so you probably already covered this, but I was just wanting to understand the components that are. Oh shoot! Let me find application, but there's like 3 components, to prepare, and then there's 2 other pieces that I just wanted to understand what those were supposed to look like.
So the prepare tool is, it's a tool that was prepared previously that CRIB has then tailored to be AIN specific, and it basically collects social determinants of health information with the idea that, you familiar with social determinants of health?
Yes.
So it collects information based off of that. So we will have that and you will administer it, and we'll provide training on how to administer it, and then we'll help you analyze those results and kind of give you guidance throughout that whole process, with the hope that you'll end with a community resource guide, which is basically kind of a way to do clinical community linkages to understand what are some of those larger needs in the community, and then how do I build relationship and reach out and create a resource that shows that offers what the services in our community are to address some of those needs. The tribal readiness assessment is also been developed by CRIB, and so we will just give that to you once you're awarded, and also provide guidance on how to administer that, and also help you analyze some of those results. And ideally, those results will be used to give justification and need for years 2 through 5 strategies. So year 1, again, kind of being focused on really engaging your team and doing some planning, doing some assessment, figuring out what are some of those needs or strategies that you want to do. And then years 2 through 5, we're really focusing on the implementation piece of those. And using that readiness assessment as a way to help identify some of those needs based off of the fundable activities of this grant.
And then the survey and capacity assessment, are those also something that's pre-designed by CRIB that we'd be implementing?
Yes.
Okay.
So all of those assessments that you're required to complete, we will be providing those for you. So you're not responsible for developing any of those tools. Now, if you feel really stoked and you want to use this as an opportunity to kind of ask about other things, feel free to, you can add that based off your organization's needs and desires. But as far as this grant requirements, you will provide everything you need for it.
And then we've done ACORNS in the past, and so like this year that just completed activities is still kind of ongoing. Can we also tie that in, even though this first year of this new cycle obviously is assessment, but can we also continue what we've been doing?
Absolutely. And in fact, well, you're applying as a tribal health program or as the tribe?
As a tribal health program.
Okay. Yeah, so you're absolutely welcome to do that. We didn't put it as a requirement because we're already sort of asking you to complete a lot. And there's, it's not a huge award amount for the tier 2 and 3. And if you have project that you want to allocate funds towards, because the project, things that we're requiring you to do don't actually cost a lot of money. It's some staff time is probably the biggest cost there. But if you have extra funds and you want to allocate those towards some of your previous or your ongoing projects, you're absolutely welcome to do that.
Okay.
I think I think we should add kind of like the last question that was asked with the yoga, on the continuing what they were doing from the last funding. So long as that we can fit them into these goals and objectives, then we welcome that. But if they're a little bit different, then perhaps, and we can maybe have that conversation. But your last explanation was a really, really good one. So I just wanted to throw that in.
Yeah, and Katya, if you want to have like a more one-on-one conversation to kind of see what that would look like, that's fine. I also know your previous project does fall pretty well in line with tribal food and beverage systems. So.
Okay. Yeah, and we'd be tailoring it more specifically. So.
Okay.
Thank you.
Yeah.
I don't see any other questions here. Maybe we'll give it a minute or two in case we have any. but just some reminders that this webinar will be recorded and uploaded to our fantastic YouTube page with tons and tons of views. And you can find that link. So before we would just send out the link, but now you can go onto our crib.org website and you can find a link to our YouTube page and to our TA requests. And you're always welcome to send us a TA request or any email to any of the ACORN site team for anything that you might think of in the future or any other TA request. Really, we're here to help. And just let us know.
So I just put our YouTube channel link in the chat and also our ACORNS page link in the chat. Yeah, and I can't, if you think of a question after this too, please just reach out. We're super happy and welcome to answer questions and brainstorm and figure things out with you. Okay, looks like we're getting the thank you signal thank yous of we're ready to close up. So we'll just go ahead and end it there. And we really appreciate all of you jumping on and taking your time. Hopefully this was helpful and hopefully it answered some questions. Again, this will be recorded, and then again, there's videos that are specific to just filling out the application or just going over the RFP and some requirements and just doing the work plans. So those are on our YouTube video or YouTube channel already, and you can check those out. And then, yeah, fill out our TA request form or reach out to us. We'll end I'll share my screen with our contact information here at the end. And otherwise, thank you so much for joining us.
Everybody.
And we're excited to work with all of you.
No, okay. I know. With you, I have to everything, everything, you're stretched.